Hi everybody and welcome to the BMS Podcast. We all have different perspectives on health, disease and illness that are all shaped by our socio-cultural environment. The aim of this podcast is to raise awareness on different socio-cultural belief systems toward health and promote culturally sensitive approaches in our Western secular environment. Hi, everybody, and welcome to this new episode of our BMS podcast. Together, we are very lucky to have a friend and a colleague from Italy, Alessandro Accorsi, and we'll discuss together about a kind of tricky topic, not always defined, but when it turns to healing beyond touch, talking about the non-physical component of the body in health and disease, like spirituality or spiritual dimension in healthcare. I felt it was the good time for us to have him with us discussing those interesting topics, and more likely because he's also organizing an important congress this year in May in Italy, where he will bring different professionals with diverse backgrounds to help clinicians understand what all these concepts may convey for patient care. So, buongiorno, Alessandro, how are you?
I'm fine. Buongiorno a tutti. Good morning, everybody. I'm very honored, and it's a great pleasure to be back with you, Rafa. After years, we find back on the same pathway. So it's an honor and a pleasure. Thank you for your invitation.
Yeah, thank you, Ale, for being with us. It's true that we met a couple of years ago when we were both members of the board of trustees of the Collaboration Foundation for Osteopathic Research. But would you mind introduce yourself for people who
Sure.
know you for the moment?
Sure. So my history, let me say, starts in Africa. It's a turning point of my life. I was 18 years old, and at that time I decided that I had the opportunity to go in a humanitarian mission, okay, in the summertime. And I was waiting as every student to start the university after this summer. But that experience of 1 month, it was the 2000. So no phone, no great connection, let me say, with the world. That experience touched me in the deep. Actually, it was not the only one, but it was a turning point. So as soon as I was back, I was, let me say, I felt a deep crisis with this modern society. So with this huge difference in life between Western society and a more rural and more poor society. So as soon as I was back, I was in doubt if starting with physical therapy or nurse science. I decided to wait. So this is an important point, and a principle that we found back in the teaching of osteopathy, especially in the biodynamic model, but it's everywhere in osteopathy. So waiting is an important point, and I wait for a year. I start from working on the bottom, let me say, of society, and I work. And the next year, it came out for me to go in nurse science. So I have a degree in nurse science, and in that place, I felt the service. Another key point that is again in osteopathy, service and being very close to people that are suffering. But as soon as I was through my studies of nursing, I understand it was not my place. It was, let me say, for me, uh, not enough being, especially in the hospital. There was always uh, complicated dynamics. So I felt the calling of something new at the time, that is osteopathy. And at the time, I remember I discovered these words. I was digging on again. This is something in osteopathy. I was digging on, looking for something. and something appeared to me. And yeah, I'm sorry if I'm quite using the expression of Dr. Sleep, but something appear. When you look for something, something appear. It came out this osteopathy. What's this osteopathy? But I fall in love immediately without even understanding the full meaning of these words. Probably as most of our colleague at the time, I felt, the great opportunity in the sports fields, for this muscular structural point of view. So I did follow this calling, and I choose at the time, again, I choose in Italy, we have two kind of training, the full training or the part-time training for people who has already some degree in healthcare. This was before, obviously, the recognition. But again, I felt that there was the need to go in deep. So I decided to go in the full training 5 years, renouncing at the possibility to work as a nurse. So I start back everything, and it was a blessing. It was a blessing because it was, again, a changing, a turning point. Then when I was at the fourth year, I decided to go to Dr. Frymann in California, because I heard at the time, all of people with our ages, we grow up at the time with these huge women that we all see physically so small, but we all perceive as a giant, as an amazing giant. So I was there, and I met great friend like Jorge, that he will join the conference. And I met, I was lucky enough to meet her again 3 times in Pescara, where she went for our work in neonatal intensive care. So as soon as I finished my training as an osteopath, I was already immediately involved in research. Thanks to the meeting with Francesco Cerritelli, we were good friends, and I was involved in church in leading the research project in an hospital in my city, Macerata. This project lead to a publication to multicentric study, Pescara, Macerata, so two hospital with the same methodology. And so we were able to publish about preterm newborn and about the improvement thanks to osteopathic care. So this was my first experience in hospital. So again, even if I thought hospital was not my place, you will see I found out myself always in calling in hospital. So maybe I have to be there. So this was the first one. Then I have had the opportunity again to lead the research in ADHD in hospital with a neuropsychiatrist and a psychologist, where we study the effect of osteopathy in those children with attention deficit disorder and hyperactivity. And again, it was a blessing because it was a reconnection with my infancy. I felt myself as an hyperactive child. I suffer in the learning at school without diagnosis. At that time, there were no diagnosis, So it was a reconnection again with myself. So after that, I just follow, several postgraduate, looking always, for the source. And again, this brings me in 2012. This lead me to start studying biodynamic model in osteopathy with Dr. Gelo's faculty. It means I in Italy. I started in Italy with the Véronique Everas, François Desrosiers, Ingrid Comery, Roberto Guglielmi, Roberto Frumento. And then in this faculty, you have a curriculum that help you growing in awareness, let me say, and open the perception. And in fact, this is a training that last at least the minimum is 10 years to be able to start managing uh, all the tools that you receive. But mm, again, I do not agree with some colleague when they create a separation. I'm biodynamic, you are structural, I'm BLT, there's no separation. And Dr. Gilus was very clear about that. Osteopathy is like a tree, and the tree has several branches. Every branches, let me say, it can be a kind of approach, but all the branches brings life, source, energy to the tree and to the roots. So it's nourishment all together, no separation. And the principle are all same principle. So,
Yeah, thank you for sharing your personal and professional journey. I wasn't aware about that, and so what I've heard is about this the early influence of non-Western civilization
mhm,
that shape the way you can understand and perceive the body. And this is something you found um, with Viola Freeman,
mhm.
and then that you wanted to explore deeper with the biodynamic faculty. And so, as you know, we have in the Western societies, the keyword is separation,
Mhm.
individualism, which is totally different compared to indigenous population or probably like you were in Africa, where the collectivity is highly important. Each person can be separated from other peoples and from their environments. So my question is regarding the biodynamic approach. Um, how would you explain that to colleagues who haven't been exposed to other cultures? Imagine that your previous colleagues, when you were studying nursing, that have been working in hospitals for 20 years now. Um, so we see the same. It's like the mere effect exposure. They are
Mhm.
not they are not rejecting other points of view. They are simply not aware that other perspective can exist and other ways of describing, perceiving a body can exist. So, how would you explain that to colleagues?
So this is a good question. The first things, um, if you are lucky to have a colleague that is open to have an experience, I will start with an experience. I will start by treating them, sharing a treatment. This kind of attitude is an attitude that is with me, and I can remember the last experience in India where I was involved in this huge research project in one of the biggest hospital for pediatric cardiosurgery in the world. So the chief of the unit care, a woman, she accepted us because we were presented to her by a very well-known Italian cardio surgeon, pediatric. So she trusts us indirectly without knowing. But I suppose we are in India, so they must be so spiritual. They must be so aware of what we are going to do. So I was just there. I was put my hands, and I was just treating by waiting, centering myself, and feeling and sensing. But I realized that they were, most of them, they were trained in a Western way, so in a very material way. There is the disease. We have to follow the disease. There's no the individual. So at that point, my strategy was and is always, I say to the chief, can we please share a treatment? If you have time enough, one of these days, can I please treat you? Because I do think and feel that it's so important that you feel in your body an experience, because we are talking about experience. So it looks like, can you go to a blind person and explain the color? It is difficult, you know. You can try, but it is difficult. It's an experience. So it happened with my patient every day, you know, since more than 12 years. They just lay down there. They just wait for my treatment. They just wait to reconnect with something that is inside of them. They just recognize. They just rest, relax. And when they are up from the table, I feel so good. I don't know what is going on there, but I'm good. I want to have it again and again. So this can be one kind of explanation. Then if I have to go with words, I have these images with some patient of mine when they came to me with an history of grave, they lost someone, and we start talking. You know, they in the treatment, you know, in the treatment, part of the treatment, it can be a moment of speaking. It can be or not. It's not up to me, but it can be. And what I recognize is that they really need it. They need to someone who recognize something that they can feel, but maybe they are scared, maybe they are not brave enough to, you know, to see. And so if you start talking with people, everyone, especially when you talk about death, that means talking about life. You cannot talk about life if you don't talk about death. And the ancient tradition, they were aware, you know, memento mori. It's one of these, but all the ancient tradition, they were very aware. So if you talk about death, at that moment, you are obliged to talk about the meaning, you are obliged to talk about the communication. And I can say to you that quite every one of them is aware, quite every one of them has an history of connection with the other dimension, with a people, a dear people. So,
Yeah, that's very interesting, and I agree with you that experience should be the first thing to make sure that people can we can go beyond words. And as you just described, in our Western societies, the spiritual care is included in clinical guidelines only in palliative care, end of life care.
exactly.
And in contrary, probably in India or in Africa or in America, in indigenous traditions, this type of connection that is called spiritual dimension in healthcare is included in the whole person healthcare. It's more holistic way of thinking, and to me, osteopathic care is unique within the manual therapy field because it allows this type of flexibility. People, if for some people this type of dimension is important, we can probably help them to manage it. But for those that don't care about this, we can force people to include this type of dimension. But osteopathic practitioners are flexible enough to adjust what you just say to the meaning and purpose of each person. And how is that? Is this the wording that you use, spirituality or spiritual dimension in healthcare? Because I assume in Italy is like in France, it's a secular country, and there's a clear separation between what has to remain in the private domain, such as
Mhm.
is on their own belief, and what can be introduced in the clinical care. And well, as you know, you're aware of the work we've provided over the past 5 years, and now especially the neuroscience of consciousness and the neuroscience of the bodily self opens new doors to describe experiences, human experiences that in the past have only been described by philosophy and religion. Now we have science that is able to at least provide kind of frameworks to describe those human experiences. But this is a new field that we are pioneering. And but I'm also a clinician, so I'm asking you as a clinician, um, for how do you bring, what type of wording do you use, and not to scare patients, not to make sure that, but to uh, to
Makes sense.
to provide effective care for them.
What I'm talking about with patient is something that I learn in a master I go through, let me say 3 years, 4 years ago. It was a master in the spiritual accompaniment to the end of life. Okay, this master was focused in a non-theological accompaniment. So it means you have to be able to not put a label. Since I'm Christian, I cannot go to a Muslim people dying and say Christ is going to wait you. It doesn't work. Again, it is not about giving rules. The spiritual dimension is something innate in every one of us. Okay, there is an interesting book from I have this book here, right here with me, from a famous historical of the religion who explained that everyone is spiritual. Okay, it means the behavior of the human race is the same. Even if you say that you do not believe in nothing, you will behave with some attitude that are the same. And again, he explained that right now, this society that is very centered on the matter, on materialism, again shows some attitude like the ceremony. So we go in the mall instead of going in the temple, church, or whatever you want. And in the mall, there are the priest. The priest is the people who is there waiting for you to buy something, and you take an object, as if it is the divine object to that is helping you to reach your meaning, your happiness. So there is this beautiful explanation, for sure better than me, in this book that explain that in the end it's something anthropological. We are spiritual. We need a meaning. Then after that, to reach this meaning, we can go through religion. Religion is a tool. It can be a tool. It can be. No? And every one of us can find its own way, its own language. I'm Italian, you're French, we are speaking English, languages, to be able to understand each other. Religion is something like that. But you know that the history of religion has led to a close fence, to control people. This is the side effects of dogmas. But dogmas in religion is like people in science who only believe in things that can be touched. It's the same dynamics, you know? Scientism, not science. So they are close to everything outside of their understanding. So again, as you say, neuroscience is amazing. It's an opportunity. We can see at the study in the last 10 years in mindfulness, or in the study on the effect of rosary and prayer on the autonomic nervous system. Again, it is beautiful, but this is a tool for us to helping us to understand something that we already feel. It's already there. It's easier. It's easier. This is the point. And with my patient, so sorry, I go to the question. With my patient, what I explain to them is I we have to help people, to feel where they are. So let me say, if there is a people that is not so open, that is scared to accept some things, I just explained the word organization recognize the three dimension of care, the spiritual dimension, the physical dimension, and the psychological dimension of care. Those are like a three circle. Okay, like there is a beautiful images from Jelus. There are three circle that intersect each other. It's the same symbol of the Trinity, again an ancient symbol. If you lack one circle, you can still going on in taking care of the other circle, but you still miss one circle, you know? So again, we have to be aware. And when I talk with my patient, I didn't say you have to go to the celebration in the church or you have to go through rosary. I just explain you are a spiritual being. You have a body, you have a spirit. Okay? So this means you have to take care of yourself. And how can I do that? I don't know. It can be in the nature. Natural world is a doorway. It can be in a wood, be in the ocean. It can be with your child, be with your dog. It can be prayer. It can be meditating. It can be yoga. It's not up to me, to decide for you. But it is um, my duty to open your eyes and to say, hey, okay, it is very good. We are taking care of your body. You are following a psychotherapy program, and this is perfect. I'm happy, but there's still something, there's another part. So this is the point for me.
Yeah, and as you just pointed out, this is the body, mind, spirit osteopathic tenet that has been reintroduced in 2002 in the United States of America during the last update of the osteopathic principles. So this is something that is unique in the manual therapy field, not just focusing on the biology, on pain neuroscience, on the biopsychosocial understanding of and person-centered care that is all that many professions are already operating within this framework. I feel the osteopathic profession has this um, specificity, this unique specificity that allows to open diverse, broader scope of non-physical component of the body, and for colleagues who are not comfortable with using this type of words, like myself 10 years ago when I was in working as a full-time researcher in Kirksville, this wasn't useful for my life at this period of time. And so we can use the wordings you just said. It's what's the meaning and the purpose? What can nourish the meaning and the purpose for you as a human being, as a father, as a brother, as a human being. So I guess this lead to the important congress you are organizing, because for practitioners who are listening to us currently and might be interested, they probably need some tools, they probably need some um, evidence, some experiences from diverse backgrounds. So I think this is what you have been organized over the past few weeks, if not months. And I'm smiling because I know this is a lot of work trying to bring many people from different countries in a single place at the same times and try to. So if you can share more information about this Congress, that would be very nice.
With pleasure, and I thank you for this opportunity. So this this congress came to me again as a service, because osteopathy is a service, and service means to recognize the humility to accept sometimes some some calling that are difficult. And this is a beautiful, this was a beautiful calling, but it is difficult, as you said, from the point of view of the time it needs, the and from the point of view of the difficulties of bringing all together in terms of concept and trying to balance them, because the service here is to reconnect the two dimension, the science and spirit, and put in evidence what was since the beginning with Dr. Steele, mind, body, and spirit. So again, in my mind, it was okay. I can organize a congress, but I have to balance it, because it can be too much imbalance from the direction of spirituality, but it's going not to be useful for the other side. So again, it can be imbalanced from the point of view of the evidence base, but the other side, it can't be happy. So the main difficulties Again, this is a principle. So this is a um, mm, not the BLT. This is a balance Congress, like in osteopathy. Yes. So the point is to find the fulcrum, find the center, find the balance, and that's why I put together a great team. You are part of it, and the meaning is to talk about, historical point of view of osteopathy, and it's going to be Jason Axton, then trying to prove that this was since the beginning, that there is a separation in Western healthcare system compared to indigenous healthcare system, and going deep and in explaining these dynamics, and you are there for this. Then we have Donald Hankinson. Donald it is, let me say, an incarnation of the legacy, because he was in Unwell study group. He is in the faculty of James Jelus. He was, and he still is, in contact with amazing osteopaths, Roland Becker, Alan Becker, Viola Frymann. So this is our history. And fortunately, he's going to be there. So I want him to talk about our legacy, our principle, you know. And after him, we have again Jorge. Jorge with his mission around the world, Hands with Heart. For me, this is an incarnation of the principle, giving service through your heart to another human being without judgment, just being there. This is beautiful. Then there is Paul Lee. Again, it's a blessing to have people with this experience. And Paul Lee, I think he can be very useful to in explaining again the spiritual side in practice, the spiritual journey of the practitioner, and the connection with quantum physics. As you say, neuroscience, but again, quantum physics can be a tool to understand, to look at some principles, some experiences. So Francesco Ceritelli, after Paul Lee, is the bridge, because he is a neuroscientist but an osteopath. He can be the bridge. He can give us the light of where we are and where we can go, to explore this dimension. And then after him, we have the other scientific or other professionals. So we have a neuroscientist who is a neuropsychiatrist, very expert in meditation and study on meditation. So I will, we will enjoy him talking about awareness and how perception change with awareness. And so again, we will go through a medical doctor and a physicist, expert in quantum physics, that can give some words and can give some light in some, in quantum physics, everything looks like strange, look like this is not possible, but it is possible. It is physics. So again, he can help us recognizing some things that are there and that are not fantasy. And we will close with two spiritual master. One is the monk I study with, I organize with Alberto Bormolini. He's a Christian monk, but anthropologist and very expert in mystics. So mystics is the key. Mystic is the place where all the religion meets, and all the religion are the same in mystics. Mystics is the experience of transcendency of our reality, and the mystics is the place of love. Love is the word that gives sense to our experience here, to our connection with our spiritual being. And we will close again with another Buddhist monk that can give light to the care, the taking care in Buddhism, from the Buddhist point of view. So as you say, it's a lot of people. And
Yeah, and for people not familiar, you were talking about Jorge Aranda. He's from Spain and based in Spain, but traveling all around the world in various missions. And I agree with you. And again, I'm sharing my own journey. 10 years ago, this was out of my scope of understanding, and I didn't need that for the way I was operating. But after personal experiences, bodily experiences, you know, all the words that may seem strange, like spirituality, quantum physics, connection, oneness, those are just words that can explain a physical experience. And what I found fantastic is that I was revisiting the early books of osteopathy. We still with people like you just said, Sutherland, Becker, and they all describe with their own words in their own context similar experiences. So, and I feel this is this is a very important congress because there's a kind of clear separation again, even in our profession between colleagues, especially in the academic world, that are more familiar with mainstream model for musculoskeletal care, and those who are and they are reluctant to explore these historical models that reflect our practice. So I feel your work is greatly appreciated, and I will put all the information in the description of this episode to encourage clinicians um, to learn more about those historical, scientific, and clinical application of those concepts that are non-physical components of the body, to move beyond the Western materialistic way of understanding a body.
Yes, it's like that. It's
Yes,
like
and
that. As you said, most of the time, I recognize myself in your description. It has happened to me the same. It was through experience, uh, and most of the time is through suffering, you know? And when you suffer with your body, you suffer with your mind. But suffering, it can makes you blind or can open doorway. Okay. So we all experience suffering, and suffering um, very often it's a doorway to reconnect with our spirituality.
I'm talking about just the the indigenous people I met. So it's only through pain and suffering that you can um, really find uh, unexpected resources within yourself. I would hope that there are different ways of, and probably other cultures like Buddhism. Probably I'm not familiar with that, but I'll be happy to hear about the Buddhist monk that will be in the conference. But um, yeah, through contemplation, meditations, probably. But in many cultures, and probably this is important for people who are listening to us who may be in a deep suffering. Just there are light at the end of the tunnel, and this is transformative experience. And the purpose of pain and suffering is to push people and to discover more than just the physical realm. And just I found an interesting article, it was not peer-reviewed journal, on Andrew Taylor still like talking about what he has endured as a human being. I think four of five of his children died. His first wife died, so he was broke so many times. So there was so if we have that if we have this look at from pain and suffering experience, because if we describe the beginning of osteopathy today, with evidence informed environment, and see, well, the guy lost five of his kids and he was sad, and then he created an alternative form of care. But they didn't they people with this type of description, they can't realize the pain and suffering he had to endure, and what resources he had to find to overcome this type of powerful human experiences. So that's another way of just bringing or understanding the history of Andrew Taylor Still and the influence on early osteopathy. And I'm sure Jason Exton have has fantastic stories to tell about this. So I think we are coming to the end of this interview. It was a real pleasure to have your perspective, and I'm glad that you brought that and in, I feel, very easy and understandable way, and always connected to your personal experiences. We're not talking about something that we can learn in books. We need a direct experience, like you say, whether and to return to the clinical professional part. And when you talk about the biodynamics, that may seem approach that may seem weird for many people, just try and
Yeah.
experience. And if it works for you, fine. If it doesn't work, it's fine. You'll find other colleagues. And anyway, so if you if you want to add final words to this conversation, that would be great. Thank you again for being with us, Alessandro.
No, it was a great pleasure for me. I do really love to talk about these kind of topics. I think that curiosity is the main science. We have to be curious. We have to be in love with the investigation. We have to be open. Otherwise, we cannot have new experiences. It's like water has to flow. Water has to flow to remain clean and pure. Otherwise, it's not good to drink.
Thank you very much, Alessandro, and see you soon in Italy.
For sure. I wait you there. Bye bye.
Bye.
Thanks for listening to the BMS Podcast. We hope you've enjoyed your chat today. BMS Formation is working to bring more compassion and tolerance between people holding different worldviews in healthcare and beyond. Share it if you like it, and see you soon.